Good evening, everyone. I am Richa Sehra, Editor-in-Chief Responsible Hospitals. Today, I would like to welcome all of you on our Insta Live session. Today's session is very interesting. I think it will excite most of the women because it is going to talk about the skin rejuvenation. Yes, we will be talking about the simple procedures of skin rejuvenation with Dr. Neha Sharma, who is an expert and who is a big-time dermatologist experienced in our industry with skin surgeries and laser. So I'll be adding her soon and we'll be talking about the simple procedures and steps. Yeah. So give me a moment in case any of you have any questions related to it. You can just write down and put it in the chat box, please. Hi Neha,
Hi,
how are you doing?
I'm good. How are you?
I'm
Finally.
happy that we were supposed to postpone the session because it's a technical thing, but then it's good that we are chatting now. So we'll just immediately start it because we are already late. So Dr. Neha, to start with, it's a very important subject. I would say that everybody has a different opinion about the skin. This is something which is very simple, on the other side very tricky. Simple because a lot of people, they keep on giving a lot of advices. You should put this and that, this will help you with this, a lot of ghar ka remedies and all, but there is no concrete way to understand the real and original steps to take care of our skin on daily basis. So I think we'll be talking about the procedures, and to start with, I would really like to ask you, what do you think? What are the simple procedures which can help us to take care of skin on daily basis?
Okay, so to begin with, most of the procedures are actually dependent on the skin type, the concern. But there are a
Mhm.
couple of procedures which are basically for everyone. Okay, from teenager to a middle-aged woman to an old age man, anyone can benefit from these four procedures. The first is
Okay.
Hydra Facial.
Okay.
Second are very basic chemical peels. Third, laser hair removal. And fourth is platelet-rich plasma. These work on inclusivity because anyone, any age group can get this done. And this is something which I personally feel are the most basic things that you can do for your skincare.
Sure. So, Dr. Neha, since you have mentioned a lot of technical terms, I am not even sure that people like most of us are still aware, but there are people who would want the treatments to be done, but they are not very clear what is this hydrofacial and what are these treatments. So, we'll go step by step. So, what do you think? Because we normally go to salons and get the facials done, 1 or 3,000, 4,000 rupees in a normal facial, which I don't think really helps us for a long time or for a long duration. What do you think? What is this hydrofacial? Just let us know about that first.
Okay. Hydra facials is falls under the category of something which is called a medifacial. Okay. Now, medifacials are based on the concept of using science behind rejuvenating your skin. You know. Now, when you go to, as you mentioned, when you go to a parlor, okay, the scientific knowledge of dermatology is not really taken care of. You know, so hydrofacial is something which uses that, and as I said, anyone and everyone will benefit from it, be it the most sensitive skin, be it an old age group, or be it a teenager. So what does it do basically? There are a couple of steps that go in hydrofacial. The first is improving your lymphatic drainage. Okay, we massage your face. There is improvement in the lymphatic drainage, which flushes out all the toxins from the skin. Now, the
Okay.
second step in hydrofacial is exfoliation. Okay, now, over a period of time, our dead skin keeps accumulating on our face, making it look tired, making it look
Mm-hmm.
dull, you know. So what we do is, with the hydrofacial comes after with the tip, we exfoliate the dead layer of the skin.
Okay.
Now the third step is something using extracts like salicylic acid and glycolic acid. Once the dead layer is gone, then we extract the debris, okay, with the help of a vacuum from each and every open pore of your skin. So once we extract it, most problems like pimples and pigmentation, dullness, everything is taken care of. So the third step, as I said, is extraction. And the last step is infusion. Now, your pores, everything is clean. We pump in these pores basically a lot of antioxidants, a lot of peptides, hyaluronic acid to give boost to your skin cells for regeneration. Basically, it is promoting them to grow. It is promoting them. It is like good food for your skin. So it gives you an instant clear skin.
Sure. So, just getting a little deep to it so that other people can also understand. So, first of all, how much time does it take and how frequently it needs to be done?
So the time taken by the entire procedure is around 30 minutes. Frequency is something I would advise, get it done once a month, you know. Then there is no downtime. It's a lunchtime procedure. There are a lot of people who come in the middle of the day, get it done, and then immediately go for their work. Okay, so there is no downtime. There is no precaution that you need to take after getting Hydra Facial done. And it is something that can be done at any point of time, and you can use makeup immediately after getting the procedure done. So no precaution whatsoever.
Any age criteria for any woman that,
As as I
when
said
can they
that,
start?
yeah, as I said, so these the procedures that I mentioned today,
Mhm.
all of them can be are for everyone and anyone. Even a teenager suffering from
Okay,
pimples can get it done. Even an old man can get it done. And as I said, all age groups, all concerns, okay, are taken care of.
understood. So, as you said clearly that, so do you think people who are, getting acne again frequently, does that help in that also?
Yeah,
Does it
as I
get
mentioned,
resolved entirely?
no. So as I mentioned, uh, basically we are clearing your pores of the
Mhm.
debris, oil, and sebum, which is actually caused acne in the first go. It is these are the things which actually resulted in acne. So your
Okay,
face is clear. Then we infuse serums, antioxidants, and peptides depending on your concern. If your concern is acne, then we will give you infusions which are specifically for acne, you know,
okay,
and that and if you have pigmentation, we'll give you infusions which are specifically made for pigmentation.
understood. And these
But
procedures
this
should
is
follow.
not the only treatment for acne. Please consult your dermatologist for getting the right treatment.
Absolutely.
This
Right,
is
so
only
true.
the
Because
yeah.
this
These
is
are
something
the
which people keep on
medication.
asking, no? That,
Yeah,
I've got acne, what needs to be done? So they won't understand the deep impacts. So I think you're right that they should be consulting the dermatologist.
yeah.
And since you've said about the other thing also, right? One thing you said, the hydrofacial, what was the second step you were, mentioning? What was the
Yeah, so the
second
second
treatment?
procedure, yeah, the
Huh.
second procedure that I would recommend is something called chemical peel.
Yeah,
Okay.
chemical
Chemical
peeling. Yeah.
Yeah, chemical peelings, it's something, the word itself is a misnomer. People often come to us saying that, doctor, you're recommending chemical peel, but, will our skin peel off? So that is not the case at all.
Mhm.
Peeling never happens. Okay. There are chemical peels which are done according to the depth. So there is something which is a superficial, then there is medium, there is deep. Only in deep peelings we notice superficial exfoliation of the skin, whereas in superficial and medium peels there is barely any exfoliation. Now chemical peels are done, as I just mentioned, for exfoliating again the dead layer of the skin.
Okay.
Then there are certain compounds which are going to tackle, there are multiple types of peels. Okay, each peel is meant for a particular concern. There is no one size that fits all. For example, glycolic peel will tackle pigmentation. Salicylic acid peel will tackle acne. Then there are peels, which are just for exfoliation, tanning, aging. For example, I have been getting my peels done every year for a decade. Every month. Because this is something which will remove the dead skin. Because we cannot remove sun, we cannot remove the pollution. You know,
Obviously.
this is the most basic thing that you can do for your skin.
Sure. So you are recommending that everyone should at least, get it done
And
once
not
in a month.
anything else, then please do
Really?
this much
Your
because
face glows a lot.
it takes
I
only
think
five
being a
minutes.
dermatologist, that's the best example you can say that you are actually taking care of your own skin.
Yeah,
That's the
because chemical peels they only take 5 minutes, 5 to 10
okay.
minutes,
Really?
and uh, once a month, and you're sorted.
Okay, awesome. Awesome. So because a lot of people have a myth, it's like a treatment, looks like somebody is doing a surgery on my face and taking out the first skin layer and there'll be a lot of side effects. So I'm sure there are a lot of myths. I think those should be clarified in the session. And
Yeah,
how
like I
about,
said,
hmm.
yeah, please go on. Yeah.
So I was saying that anything you want to add to this chemical peeling so that I can move
Yeah,
to the
as I
other question.
said, like peeling, the word peeling is a misnomer. Okay.
Yeah.
Uh, it is something that I have been getting people to actually get it done in the middle of the day because it takes 5 to 10 minutes. Peeling only happens when we are using a very deep peel for a specific concern. For medium and superficial peels, there is absolutely no peeling. You might just find your face dry for 3 to 5 days, and that's about it. And it takes only 5 minutes to do it. So, yeah.
Sure. And one more thing to add on to, since you have said that that it takes about 5 to 10 minutes, not more than that, which even I wasn't aware, frankly, since I have not got it done ever, and I will try this after the session. So I was saying that, do you think so? There are specific machines which does it that which you think anybody should understand the technicalities behind it, or they just need a right dermatologist.
No, so the chemical peels are not done by machines.
Okay.
So it's an application of a particular serum on the face. That's all.
That's all? Oh my God.
Yeah,
Okay.
yeah.
Then
But
this
these
was a
are
big
things that you can, yeah, these are things that you cannot do at home because the concentration and the potency of these serums are quite high, So has to be done under the right guidance. But yeah, it's not a procedure which requires a machine for it.
I would say a lot of people are burning a lot of money in the salons. They could actually take these services rather than we
Yeah,
spend
absolutely.
about so many thousands in the salons and we never understand the long-term effects which these things can actually help them out. So third procedure I think which everybody would want and keen to know is laser treatments, because I was getting a lot of requests from people that do a session that whether we should go for laser or not, what are the side effects, how does it help. So let's talk about that. What do you think about it?
Okay, so when we talk about laser hair removal, it is one of the most commonly done procedures today in the field of dermatology. It is the most, it is something that I think we've reached a stage where people have stopped consulting also doctors. They just want to come to the clinic and directly, book a session for laser hair removal. It's so frequently done. Now, I feel that a lot of people are hesitant because of two reasons. One, they feel that the cost is an issue. Second, that when they hear the word laser, they get a little scared and they think whether it's going to be painful or whether it's going to be harmful in the long run.
Yeah.
So I think these are the two basic things which prevent people from actually getting the laser done. So I'll
True.
discuss this. Now, when you get, for example, when you get waxing of just your underarms, over 2.5 decades, like 25 years, because that's the time we actually do our waxing, we spent around 2.5 lakhs on getting waxing of just underarms done, you know.
Awesome. That's a
And
good
this,
calculation.
yeah, and then we go to the parlors, we waste our time and energy, fuel every month. and every 1.5 month to get it done, you know. Whereas in laser, okay, in couple of thousands, you're sorted for life, you know. So initially, you might think that, the session is going to cost you this much, but when you calculate how much time, energy, and years it's saving you, and you actually calculate that in 25 years, you're actually spending so much money on just underarms, you will understand that lasers are much, much more cost effective. And after a while, your skin becomes thin as you age. Waxing, shaving are going to actually not be very good treatments. Then you will be lazy, but once you're done, like these days people are so informed that by 18, between 18 to 21, they're usually done with all their sessions, and then they're free for their life.
Absolutely, that's what I was thinking, and it took me a lot of years to decide, and I'm doing it now. But I'm so happy and glad to do that. Uh,
Yeah.
well, getting into the laser thing, again, I got a question initially saying that there are different kind of machines which come for laser, and some of them are painful, some of them are pain-free, some of them have good results. What do you want to say about that, and how do they decide?
Okay, so most of the machines today are not painful. I think the painful machines, I don't think they exist anymore. All you feel while getting the laser session done is maybe a little warmth, but with the latest technologies, even that's taken care of. Then, the kind of hair that you have, your your laser depends on that. But mostly for Indian skin tone, a diode is a good choice. When we come to finer hair, at that time we can think what others to choose. But for Indian skin tone, still I would say diode is a very good choice.
Sure. Adding to this, one more question that does laser, removes some people say that the Kaya people say that, it reduces the hair growth. But then there's again a myth. It reduces or it removes overall.
Okay, so laser hair, it causes reduction, permanent reduction. Now, when you understand the word permanent reduction, you have to understand that there is reduction in the density of the hair. So the number of hair that you're going to get, that has permanently been reduced. That's taken care of. Second, there is permanent change. The change is again permanent in the uh, type of hair that you're going to get. Initially, it would be thicker, darker, coarser, but for good, after you've completed your sessions, it is going to turn into a very fine hair. Like, for example, anyone who has completed their 6 or 8 sessions, they would understand that whatever new hair that is coming is such a baby hair that you can barely even see it.
Which is
So,
amazing. No? That's the result which everybody would
yeah,
want.
so that is, so again, so the hair is still coming, but there is permanent reduction in the density, and there is permanent change in the kind of hair that you're going to get.
So I think people who are having very strong, or I would say very hard hair, for them it's really a great idea to get the laser treatments done at least.
Yeah, I think yes, absolutely. And even people who have like not thicker or coarser or darker hair, even
Okay.
for them, what this would do is this would reduce the density. So the number of hair that they're going to get, okay, over a period of time is going to be much lesser. So even then, the needs for shaving, waxing, threading, everything will not even exist, because anyways their growth is not so, high. And then when it causes permanent reduction, then you're basically sorted.
And Dr. Neha, these days I think these laser treatments are done at salons also. So, I mean, people are again confused that should we go with the dermatologist part or should we get it done from the salons?
So there
And
are a
do we
couple of
require a doctor or
problems.
not?
Yeah, so there are a couple of problems that I personally have faced.
Mhm.
Uh, not everyone. So we seriously insist because there are a lot of people who just directly call us and want to book sessions for laser hair removal.
Mhm.
But we need to see the skin color. Okay, that's a huge factor in deciding what settings of the laser would suit you. Then
Okay.
the type of hair that you're getting, because, and most importantly, the area that you want to get treated, because there is also something called paradoxical hair growth. If you do it on an area which does not have hair, then you're going to come back with thicker hair, you know. Then
Mhm.
I think the settings should be set by a dermatologist. We are very particular about that, because that can lead to burn, that can lead to increased hair growth, and that can lead to something, even pigmentation in certain individuals. Then burns again is a huge problem because someone who is not educated about this, they would not know what setting, because they're just doing it mechanically without any scientific knowledge. So burns again is a huge problem. Then third, the other major issue that we face is in females, who have hormonal changes. We need to combine a lot of medical treatments along with laser because otherwise they won't get results.
Okay. Sure. That's important to know. So, another procedure which we will move to, that is PRP, right?
Yeah,
So,
PRP.
let's talk about PRP. What is PRP now?
Okay, so PRP is something called platelet-rich plasma. Okay,
Mhm.
it is uh, it is a form of regenerative medicine that is natural. That is the most natural form of medicine that we use for our skin hair, not only our skin hair, but for treating joint pains and for treating ulcers, wounds that are not healing because it is dependent on your own body's regenerative capacity. Now, what we do in PRP is we take your blood, okay, centrifuge it. The uppermost layer it contains platelets. Now, these platelets are of your own body and they're rich in growth factors of your body, like various growth factors. There are so many, but these growth factors they help in doing two things. A, stimulating collagen. Okay, so you can use it for your face. In Hollywood, it is really famous by the name of vampire facial. And the other thing is because these uh, platelets they contain growth factors, we apply them on the scalp also to boost your hair growth. Because after a particular age, the normal tendency of a human being is to lose hair. It's not that suddenly at the age of 50 you will get up and say my head is full of hair. That does not happen. you know Now what is, we have multiple medicines and supportive therapy, but what is most powerful is actually your own blood. So
Okay.
when we extract these growth factors from your blood to heal your skin and your hair, the results are extremely powerful and they're long lasting as well.
So, this is for, you said, hair growth, right?
This is for, so we use it for treating acne scars because
Okay.
these growth factors, they build collagen, you know. So when you build collagen, your acne scars are better. Your skin becomes more firm. The texture, the skin feels more tight, so it's anti-aging. Then for the hair, it stops the miniaturization of hair follicle. It stops your hair follicle immediate, hair follicle to fall. Then it start, because since these growth factors are food for your hair, so it suddenly promotes a lot of new hair growth.
Sure. And is it like, is it again, is it done with some machines or is it a manual process? How is it?
So again, you'll be surprised. Doing this procedure actually just takes 10 minutes. It's just that we take 20 to 30 minutes to prepare the blood, but when it comes to the actual treatment, we're done in 10 minutes. And there is some amount of redness on the face after the treatment, which will last for a day. And that's about it. You can resume your activities after a day.
And how
Like
much
if you
blood
get
is
damaged.
needed from everybody? Is it different from every human being?
No, so it depends on the area we are targeting. But, it's like almost the same amount that you give for a blood test. That's all.
So it's okay, and it's like once it's done, or it has to be repetitively done once in a month or a year.
Okay, so PRP treatment or any other skin treatment, okay,
Mm-hmm.
it's a choice. It's not like a heart attack that you have to immediately get a surgery done. Okay,
Mm-hmm.
so for taking care of your skin and your hair, you yourself first have to be motivated. You know,
Well, I think
otherwise,
I don't know that I think I should ask this that because a lot of people think that these treatments are very costly. Maybe that's the reason they don't want to put a lot of money and they are not even
no,
aware
I
what
think
the
you should.
results.
I think you should actually consult a dermatologist, and you'll be surprised at the cost. They're not
Is it?
costly at all. Yeah, they're not costly at all. These are certain things that you can, and this is not something that you have to do very frequently as well. You know. So as I just mentioned about laser hair removal, it's the initial,
Investment
initial
and
thought,
land.
yeah, that
Mhm.
scares people. But when you
Mhm.
actually calculate in long term the kind of time, fuel, and the money you're spending over 20, 25 years, this would definitely come out to be cheaper.
Sure, sure, sure. And since you know that a lot of people are not even comfortable about these procedures even till date, they're like ये पता नहीं क्या सारी चीजें new आ गई हैं market में and हम तो अपने time में that we used to put just cream and that's all we used to do. And these days people do CTM at home regularly. Do you think that also helps and people should keep doing that? Let's talk about some home things as
Yeah,
well
so
along with it.
yeah, absolutely. So any treatment that you do, it has to be backed by your daily skincare regime. Nothing can replace that. If you're not using a sunblock, and if you get it going and getting some treatments done with a dermatologist, and you have missed out on your sunblock, everything will fail. You know,
Really?
so your daily skincare regime plays an important role. The most basic things would include like inclusion of a vitamin C serum and a sunscreen. Rest, of course, someone will, you have to show your doctor and they will tell you what exactly would suit your skin. But if basics are not right, then these treatments would not work.
Sure, sure. So, any suggestions you would like to give it to all the people who are listening to you or who will listen to you after the session? That what are the basic things they should follow on daily basis so that it can really help them, adding these methodologies which we have just mentioned.
Yeah.
You said the vitamin C serum. Any
Yeah.
steps or any recommendation that they should wash the face and whatever?
Yeah. So, most importantly, you have to understand that your skin will be supple and soft, healthy only and only if you're hydrated. If you're not hydrated and your skin is going to age much, much sooner, you will have flakiness, you will have rashes. Okay. Now, hydration is of two types. One is in drinking enough water. Second is using a moisturizer. A lot of people, if they have oily skin, they will just skip the moisturizer. Don't do that. There are certain water-based moisturizers that are available for people who have oily skin. So moisturizing is the most basic thing that you can do for yourself. Drink 2 to 3 liters of water, because when you flush out those toxins, it actually reflects on your skin. Your skin is the mirror of your body. Any internal problem is going to reflect on your skin and hair. If you, for example, even if if you've just delivered a baby, you're going to lose all your hair because your body has been under stress. So any internal problem is going to reflect on your skin and hair. So drink a lot of water so that your skin remains clear. and soft. Then moisturize your skin enough, because any kind of wrinkles, aging, rash, all this will happen more on dry skin than a hydrated skin. Then second is vitamin C serum. Now, vitamin C serum is a powerful antioxidant. So it reduces the damage done by the sun. Now, vitamin C serum, which is, as I said, is an antioxidant, is ideally used before sunscreen in the morning. So that because the UV rays are going to cause some amount of oxidative damage for this, on the skin, and vitamin C will block that out. And you can again use it at night as well before sleeping. Third is sunscreen. Now, sunscreen has to be used 30 minutes before you step out of the house, because it takes 30 minutes for the sunscreen to start acting. An SPF 30 will give you somewhere around 97% protection, whereas an SPF 50 will give you 98% protection. So even if you're using SPF 30, it's completely fine. Just make sure that you're using adequate amounts. There are a lot of people who will just use pea size for their face and neck, and that's not sufficient. So if you're using, whether it be SPF 30 or 50, I would say use more quantity rather than, getting concerned about what SPF you're using. And don't leave out of your neck, because the difference between face and neck becomes very apparent. People take a lot of care of their faces and they forget to apply these products on their neck. So that
True.
shows. Then again, the other thing that you can look out while choosing a sunscreen is the SPF, as I mentioned, and something called PA factor, which has to be 3+. Like, all this information, actually, I have already put it out on YouTube also, in details about how actually you can go to a chemist and select a sunscreen for yourself. You'll be educated once you see that video about how to choose. So sunscreen is again, but if you're, sitting in an office which has a lot of windows, I would say that please reapply your sunscreen after washing your face after every 3 to 4 hours, because after 3 hours, it is as good as not wearing one, if you haven't reapplied. So don't apply it on sticky face, make sure that you wash your face and then apply
So,
it, because otherwise it'll
are you
block
trying
your
to say
pores.
that, I'm so sorry, that first layer could be the moisturizer and then the sunscreen lotion,
Then the vitamin C, and then
then
the
the
sunscreen.
vitamin C, and then the sunscreen? Cool. Okay. Sure. I think anything else you would want to add on?
So I think
We are
this
almost
about.
done with all the procedures. I think these procedures, even people do, that's like enough, right?
Yeah, so I think for the basic skincare, I think you should start with these three, and enough hydration. So this and vitamin C is a very good antioxidant. Start it early. You can start it in your teenage years also. In long term, it will help you. Even sunscreen, people who start early, they have less damage on their skin in 30s and 40s.
Awesome. That's a great informative session, I would say. Dr. Neha, thank you so much for being with us, because it's really informative and insightful session. Thanks for being with us, and we'll see you again with another topic.
Thank you. Thank you so much. It was lovely talking to you.
Thank you. Thank you, Neha. Bye-bye. Take care.